Hello, my name is Aquin-Martin and this is my nursing assessment. This is Evan, who will be standing in as my patient.
Hey, I consent to being a part of the assessment.
Thank you. Okay, and now we are going to do a environmental scan. Okay. For background information, Evan is a 27-year-old patient who has been admitted with an asthma exacerbation. He has no significant outstanding medical history other than the asthma, and his last hospitalization for an asthma exacerbation when he was 10. His vital signs are going to be assumed, as we are not going to be taking them for the purpose of this video. His temperature is 36.6. His heart rate is 84. His blood pressure is 136 over 78. And his respiratory rate is 22. And his oxygen saturation is 94 on room air. Are you ready?
Yep.
Okay, we are going to assume that I am going to be doing hand hygiene before I enter the room. So I'm just going to knock on the door.
Come in.
Hi, Evan.
Yeah.
Hi, do you mind if I just come in and have a quick chat with you?
Sure.
Okay, I'm just going to shut this door for privacy for you, okay?
Sounds good.
I ensure that the door is shut and any curtains are drawn to provide ultimate privacy for the patient, and that we are in a private or semi-private room, that we are speaking at a tone comfortable for the patient. Hi, my name's Jillian. I'm going to be your nurse for the day.
Nice to meet you.
Good, nice to meet you as well. How was your, are you able to confirm your first and last name and date of birth for me?
Yeah, it's Evan Tonge and August 7th, 1997.
Okay, and that is matching his documentation that I have. And do you have any allergies, Evan?
No.
No, okay, and he does not have any allergy wristbands on. And his charting also states that he does not have any known allergies. Okay, so I'm gonna come in and just do a quick assessment and maybe ask you a couple questions. Does that sound good?
Sure.
Okay, if at any time you have any questions for me, just feel free to interrupt or stop me, and I will also check throughout the video if you're doing okay.
Sounds good.
Okay, so I heard you came in with an asthma exacerbation.
Mm-hmm.
You haven't had one of those for quite a while, eh? Since you were a kid.
Not since I was 10, I think.
Yeah, okay, so can you give me a little background about what was going on before you decided to come into the hospital?
I worked a shift at my job and I worked construction.
Okay.
And then my friends ran a marathon or a 5K and I joined them.
Okay, so you work in construction, so you deal with a lot of dust and a lot of grit and things like that you're inhaling. Okay, do you wear any sort of mask while you're at work or anything?
No, our company doesn't give them to us.
Okay, and you don't have an N95 mask or anything like that you wear? Okay, no. And are you a runner regularly?
Not usually.
Okay, was this kind of like a fun, like almost like a mud race or something?
Yeah, my friends did it, so I did it.
You did it, okay. And this was yesterday and you were admitted last night?
Yeah, so I went to bed that night and woke up in the middle of the night and couldn't breathe.
Okay, so how are you feeling right now breathing wise?
Not great.
Mm-hmm. Has it gotten better since you arrived, since you were admitted?
Slightly after they gave me medication.
Yes, so we've given you some inhalers and we have also given you some nebulizers. Do you find that those have been helping?
Yeah, definitely more than my inhalers at home.
Okay, so you do have inhalers at home. So you have, do you know what they're called by chance?
I have a blue and an orange one.
Okay, so you probably have something that's going to open your lungs up, and then you also probably have a steroid to follow that. Do you take those routinely, or is it just when you're having trouble breathing?
I should take them more regularly.
Okay, alrighty. So on a scale of 0 to 10 for breathing wise, 0 being you can't draw in a deep breath, you can't carry a conversation without stopping multiple times, and 10 being you're breathing regularly, you're not having any difficulties, where would you put yourself?
Probably a 6.
Okay, so it's not too bad. You can carry a conversation. Do you become short of breath upon like moving around the room?
If I were to exert myself, yes.
Yes, okay, but at rest you don't feel short of breath at all?
Just a little bit right now.
A little bit,
yeah.
Okay, sounds like a plan. Are you coughing at all?
Occasionally, yeah.
Okay, when you cough, are you bringing up any sputum at all?
No, it feels really stuck.
Okay, does your chest still kind of feel that like tightness? Yeah, okay, so that hasn't really dissipated, has it?
No.
Okay, are you having any pain?
No.
No? Okay, so on a scale of 0 to 10, 0 being no pain, 10 being the worst pain, where would you put yourself?
0.
0. Lovely. Okay, so what we're going to do is we're going to do a lung assessment, and I will explain that as we kind of partake through that. After the lung assessment, I'm also going to do a perfusion assessment. Just make sure you're perfusing oxygen throughout your body efficiently, and that's also going to be listening to your heart. Does that sound okay?
Yeah.
Okay, so what I'm going to ask you to do is I'm going to ask you if you're comfortable to just move down to the end of the bed, and I'm going to start your lung assessment, okay? Okay, so I'm going to do my IPA assessment for this. So I'm going to inspect, palpate. We are not doing percussion for this video, and then I'm going to auscultate. So what I'm going to start with is I'm just going to observe you breathing, okay? And then I'm just going to kind of inspect how you're breathing and just make sure that your lungs are rising and falling symmetrically, okay?
Sure.
And take a nice deep breath. Lovely. From just observing, his lungs are rising and falling symmetrically from what I am like seeing. So now I'm going to palpate. Okay, so I'm just going to lay my hands on your chest in a couple different spots, okay?
Sure.
For the purpose of this video, Evan is going to keep his shirt on. For a real life assessment, the patient would have hopefully a gown on, or I would ask them to remove their shirt to get a better look at their chest, okay? So for observation and I would also be looking for any kind of masses, any swelling, any kind of cuts or bruises to his chest area that could be also contributing to his admission reasoning as well. Okay, so now I'm just going to palpate, so I'm just going to rest my hands on your chest, okay?
Mm-hmm.
And just breathe regularly. Okay, and take a deep breath. And one more time. Okay, and then I'm also just going to go to his 10th intercostal space, and I'm just going to kind of band my hands around. Okay, good. And deep, deep breath. One more time. Wonderful. Okay, so from my palpation inspection, I am noticing that his lungs are symmetrically rising and falling. Okay, so I'm also just going to check for crepitus. So I am going to press my hands in different aspects of his intercostal muscles and ask him to say 99. So I would like to hear the vibration from him saying 99. Okay, and go ahead.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, good. So there's no concerning observations there. I'm not finding anything concerning for my IPA assessment. So now I'm also going to auscultate, okay?
Sure.
Again, for the purpose of this video, Evan is going to keep his shirt on. If this were a real life assessment and I was going to be auscultating, I would auscultate under the shirt for the purpose of this video so you are able to observe. I am going to have Evan keep his shirt on. So I'm going to start my auscultation assessment above the clavicle and go in a ladder pattern down his chest. And I am going to listen for at least one inhale and one exhale. And if I hear any adventitious sounds, I may listen for a couple more respirations. Okay, just when I'm going to use the diaphragm of my stethoscope. When I rest my stethoscope on your chest, just take a deep breath for me, okay? Okay, thank you. So with my anterior assessment, and my auscultation. So what I did here is I did hear a bit of decreased air entry into your bases. So that just means that sometimes when you take a nice deep breath, air isn't reaching fully to expand the bottom of your lungs as well, okay? And then I'm also just hearing wheezing throughout his lung field. That is very typical for a patient with asthma exacerbation, especially because you are just coming in with that admission, okay? So that should get better throughout your treatment, okay?
Okay.
If you're able to, are you able to just flip around and we will complete your posterior assessment. Okay, so now I'm going to do my IPA again, just posteriorly, okay? So I'm just going to do all of the things I just did, just with the back, okay?
Sure.
So I'm just going to identify and watch him breathe. So nice deep breaths for me. Okay. And I would also be looking for any masses, any swelling, any sort of disruption to the skin for this assessment as well. Okay, and then I'm also just going to rest my hands on your back, okay, and palpate. So for this purpose, I'm just going to come this way. And I'm just going to kind of come below the clavicle, okay? Good, and then I'm going to come to around his 10th intercostal space, and I'm going to almost just band my hands around him. Good, and then nice deep breath. Good. So from that, I am identifying that he is, his lungs posteriorly are rising and falling symmetrically, okay? So that looks really good, okay?
Cool.
And then I'm also going to check for crepitus firmitus as well on the back and have him say 99 again and just listen for that vibration. Okay?
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Good. Okay. So that sounds good. I'm not hearing anything concerning with that. Also with my assessment and my palpation, I'm also looking for any kind of subcutaneous emphysema or anything like that. He is not presenting with anything concerning there. So now I'm going to auscultate, okay? So I'm going to have a listen. So again, I'm going to be listening above the shoulder blade here, above the clavicle. Okay, so go ahead, have a good. Okay. So again, I'm hearing a little bit of decreased air entry to the bases as well. So I'm just hearing not a ton of air entry to his bases back here. And then I'm also just hearing wheezing throughout his lung field. Any questions about that, Evan?
Not really, no.
Okay, awesome. So we're done our lung assessment now, So what we're going to move on to is we're going to move on to a perfusion and heart assessment, okay? If you're able to pop up on the bed and have a lay down for me. Okay, so I'm going to just ask you a series of questions and then I'm going to do an assessment as well,
Sure.
Okay? Any numbness or tingling to your hands or your feet?
No.
Any pins or needles or anything?
No.
Can you wiggle your hands for me? Perfect. And wiggle your toes? Lovely. Okay, so I'm also just going to check for cap refill, and I'm just going to, the expected response for him is going to be less than 2 seconds for a capillary refill. So I'm just going to press his nail bed and release. And as expected, he has less than 2 second cap refill. For the purpose of this, Evan has socks on. We are just going to assume that his toes are less than 2 seconds as well, but I would just hold and release. And less than 2 seconds. Okay, perfect. And I would also, at this time, look for any edema throughout his body. Evan does not have any edema throughout his hands or his feet or his legs. But for an edema assessment, I would just make sure that I would be testing for any pitting edema. I'm also going to be looking for any jugular vein distension. So I'm just going to ask you to turn your head. And I also just want to be looking for the pulsation of his carotid artery in his neck. You should be able to see the pulsation. I shouldn't be able to see it bulging or anything like that. His vein looks totally normal. Okay, so I'm just going to feel for your pulses at your radius, so right here, and then just down at your feet, okay? Your
Sure.
pedal pulses. For these pulses, I would listen for 30 seconds to a minute to get a heart rate and also get a good feel for the pulse. Good, okay. And then I'm going to be identifying pedal pulses as well on both sides, so bilaterally on both feet as well as both wrists. Okay. Good. I'm just going to feel this wrist as well. Very good. Okay, so now I'm going to just do a quick chest assessment. I'm going to observe it, and then I'm also just going to listen to your heart sounds as well, okay?
Sure.
So I'm going to be listening in 2 locations for his heart sounds. I would like to listen and hear that classic lub dub, and if I hear any adventitious sounds or abnormal heart sounds. For his apical pulse, I will listen for a full minute, but for the purpose of this video, I'm just going to be listening for the lub dub. So I'm going to find his second intercostal space. Okay, and then I'm going to come down almost to his fourth intercostal space. Okay, good. So for his heart assessment and his perfusion assessment, he is perfusing appropriately, and his heart sounds sound appropriate. There are no concerns there. He would be in normal sinus rhythm for this. His heart rate is normal for his age. So Evan, our assessment is now completed. Do you have any questions for me?
Not at the moment, no.
Okay, so what I'm going to do now is we're just going to go about our day, and I'll go and grab your medications, okay? But if you have any other questions or your breathing starts to get worse, you just let me know, okay?
Okay.
Okay, thank you so much.
Thank you.